All right, welcome everybody to our third installment of the webinar, What's What Meetup. So today our topic is going to be low back care. You should all probably know me by now, but I'm Zach. I have a bachelor's in exercise science along with health promotion, and I am a National Strength and Conditioning Association certified strength and conditioning specialist. So a little bit of a longer one, so we'll hop right into it. Our major objectives today with this presentation is to explain the causes and triggers for majority of lower back issues and identify different tips and stretches for helping you to prevent those lower back issues. Okay, so first off, let's test your knowledge. Whether you want to write this down, say it out loud, whatever it is that you want to do, but how many adults will experience low back pain at some point during their lives? Okay, so you got 4 chances here, percentages. I know it zooms past it pretty quick, but you don't really want to think of it as multiple choice as much as just what do you think the percentage is? Is it high, is it low? All right, so 80% of adults will actually experience low back pain at some point in their lives. In fact, low back pain is one of the biggest reasons for missed work days and the leading cause of job-related disabilities. So what are some common causes of low back problems? Sprains and strains, which may come from causes such as poor lifting technique, lifting an object that is too heavy, twisting or overstretching, moving a load or performing a task too far away from your body. Your lower back is not designed for rotation, it's designed for stabilization. So that's kind of how you want to think about it. Spine wants to be stacked on top of each other. That's what's going to make you the strongest. Okay, trauma, which could include, different injuries that have happened from different sports when you were younger or currently, accidents or just general falls. Problems with your discs, which is the cushion in the vertebrae in the spine, whether it's ruptured, bulging, or degenerative over time. These can cause issues. Arthritis and other medical conditions such as scoliosis, fibromyalgia, pregnancy, just to list a few. Many other factors, such as compressed spinal nerves, skeletal issues, or infections that can go on. All right, so what are some triggers? All right. Many health conditions or injuries can cause lower back problems. Many times back problems come over time due to different lifestyle factors or even a result of one bad movement. Maybe you can remember, if you're part of the 80% that experience, maybe you remember one specific movement that you did or improper lift. So starting at the top right, going clockwise around, let's just look at it. An active lifestyle, physically fit muscles are less prone to injury. Staying in a single position, whether sitting or standing for too long, may cause discomfort. A lot of people want to get these standing desks, and yes, I'm all for that, but I have a different thought about that. I don't think it's necessarily the position that you're in. I think it's just lack of mobilization, of inactivity. Whether you're standing in one spot for a long time or sitting in one spot for a long time, it's going to cause the same effect. So you just want to try to keep moving. I mean, that's what's going to make your muscles more resilient. Poor posture, whether it's sitting or standing. If you got a standing desk and you have poor posture, your shoulders are still rounded, your chin is coming forward. What good is that standing desk doing for you? Even driving. I know personally, I kind of lean to one side when I drive, and that causes a lot of tension on the other's lower back, one side of your lower back. Overexertion in work or play, such as those people that are weekend warriors. They sit around and do work all week, and then they work out as hard as they possibly can during the weekend. Your body's going to be super sore because your body isn't used to that much activity. Poor body mechanics, whether it's just that posture again, or it's, when you lift and you're not doing proper mechanics. That's why we have people like myself, strength and conditioning professionals, certified personal trainers. We're designed we are trained in anatomy. We know exactly how to move your body properly to make you strong. Okay, being strong is not dangerous. Being weak is dangerous. Okay, tobacco use. Tobacco use can even interfere with the nourishing of your body, slows your healing. Coughing can even lead to lower back pain. Poor sleeping position, whether it's your mattress, whether it's, you lie on a certain side or just different positions can cause lower back issues. And just your common stress. It has several effects on the body. It may increase your muscle tension, Behavioral health concerns such as depression and anxiety may influence pain and how severe it is perceived to be. Okay, so caring for your back, how do we prevent these lower back issues? Well, when starting an exercise program, remember to start small, gradually increase the time and intensity, and don't be a weekend warrior. Strengthen your core muscles. Okay, your core muscles are both in front, back, and inside. They're muscles that surround your spine. Okay, so there's many different ways that you can go about this. It's your body's trunk. Think about your armpit down to your waist level. Keeping them strong is going to support that spine. Keep it in proper, posture, so to say. Make stretching a regular part of your routine. Okay, so stretching can help reduce the stiffness and even increase the range of motion, which in turn is going to reduce the risk of your injury. You want to keep moving. We're always going to come back to that. Whether you're standing at a desk all day or sitting at a desk all day, it's inactivity. Okay, so keep moving. Set a timer, whether it's every 15 minutes or people have a Fitbit, I know 10 of the hour. It'll always give you the message as to how many steps you need to move in order to get up that 250 an hour. This is all of this is going to decrease, your risk for lower back issues. The proper mechanics, proper posture. These can be done with someone like myself, personal trainers, strength conditioning coaches. There's posture specific group classes on the Wellbeats that you can be going to. There's posture specific exercise and muscles that you want to be looking at. Now listen to your body. If you feel pain, then stop. Don't push through it. Okay, there's no such thing as no pain, no gain. Do not listen to that. That is so old school. You're going to hurt yourself. Okay. So let's talk about managing that discomfort. If you experience back discomfort, there are some things that you can do that may help. So we'll talk acute, which is your short term, often gets better on its own. Hot or cold packs might help relieve discomfort. As much as possible, keep moving to reduce that stiffness. We're always coming back to that. Sitting or lying still may actually make the discomfort worse. Movement helps with healing process. Always tell this to people who have heavy leg days, or we do a lot of legs, a lot of reps, low rest, and those legs are extremely sore and they're tough to move, to walk. The last thing you want to do is just sit around. It's going to make that fascia get tighter and cause a lot of tension on your joints. Best thing you want to do is go for a leisurely walk, an easy bike ride. This is going to increase blood flow, nutrients into that muscle, and decrease its recovery time. Okay, over-the-counter pain relievers such as ibuprofen, aspirin, these can help, but use with caution. Okay, I'm not prescribing this. I want to make that very clear. Disclaimer: I am not a doctor. This is for educational use only. Okay, please talk to your pharmacist or your PCP about taking any of these if you have any cautions. Then there's the chronic stuff, the long-term injuries. People who've dealing with this for a long time. Your whole hot and cold packs may help relieve that pain, discomfort just temporarily, but it might not be a long-term solution. Regular physical activity. Resume being active as soon as possible while avoiding movement that may make the discomfort worse. So, if you have lower back issues, don't jump right into some big compound motions such as deadlifts and back bar squats. Start small, start with some isolation exercises, but maintain that healthy lifestyle habits, promote healing, and help prevent future discomfort. Examples including a nutritious eating pattern, getting adequate, good, nutrient-dense foods. This is going to decrease your recovery time. Getting good quality sleep, giving up tobacco if you use tobacco. It affects you a lot more in ways that you think that just come to the top of your mind. Finding ways to relax and effectively relieve stress. And medications, you're over the counter and prescribed, may help if recommended by your healthcare professional. Okay. So that's the pain. Now, what are some preventative measures that we can take as far as stretches, exercises? So when you sit all day, the two muscles that are going to get the tightest are the many muscles that make up your hip flexors and your hamstrings. A lot of lower back issues aren't actually lower back issues. They are other muscles that are tight or lack of mobility that is causing tension on the lower back. So look at this hamstring stretch for you. All right, so you can make this more intense by putting your leg up on a box. If you do Wednesday group class, I turn this into a dynamic motion. called the RDL walk, where we start on one side of the room and walk to the other side, just holding 1 to 2 seconds. You want to place one leg in front of you, keeping your heel on the ground, knees straight. I'd even say a very, very slight bend in it. You don't want to have it locked out. You may wish to stand next to something, a wall or something to hold on to for balance, keeping your back straight, which is important because we want to make sure we have proper posture. We're not rounding our back or arching the back. Okay, place your hands on the thigh or hips for support. Lean forward at the hips, pushing your butt back. Repeat on each side. Okay, you should feel mild pulling, a slight discomfort in an exercise. The more you perform it, it'll feel less and less. You can go deeper into the stretch. Okay, this back bend, ooh, that looks good. All right, so place your hands on your hips. Lean backwards slowly. Okay, maybe have a little bit of a wall behind you just in case you do lean back too much, you don't fall and crack your head open. All right, lean slowly in a controlled manner. If you experience discomfort, perform the movement more gently, pause for a few seconds, then return to the starting position. So I just want to make this point real quick. These are pre-made presentations by our employer. I want to show you an alternative. I can't really show you right now, but I'll break it down. If you were to picture this guy lying on the ground, so he's basically making out with the carpet, all right, you want to think of that as a little bit of a safer stretch to do with this. And instead of putting your hands on your hips, you can get your forearms and wrists underneath you and use those to press into the ground to slightly arch your back. Okay, this is going to provide a little bit of a safer stretch than this. That way you don't have the risk of falling back and smashing your head on the wall or on the ground. But many other exercises that we can show. So if you have more questions with this, please feel free to reach out. Okay, what about a quad stretch? You know, this is another one that's going to hit the hip flexors, which is probably one of the most, the muscle that's going to get the tightest after sitting all day. Okay, so this one's pretty simple. You know, grab onto a chair, railing, or basically anything. Stand behind it with your feet about shoulder width apart. Grab that ankle. Pull it back, okay? Make sure that that knee of the leg that you are pulling back is pointed straight at the ground, and you're keeping it tight to the midline of your body. Okay, that way we know we're hitting just the quad. Okay, what you can also do in the stretch is if you're a little more advanced and you can do this balancing, standing on a leg, and you don't need something to hold on to, or even move that object to the side, you can lean forward just a little bit with this, bringing that torso over the front toe, and that's going to create a little bit more intense stretch. What are some red flags? Okay, so while low back pain will often improve on its own, there are some situations where it's important to seek care from a doctor, as they may be signs of something more serious and requires treatment, such as numbness or tingling in the legs or extremities. Okay, so we're moving past those acute care stuff. This is now where if there's pain, there is no gain. Please go. You have an issue. Please go see a medical professional. Okay, so it's severe pain that's just not improving. A pain that may be caused directly from a fall or an injury that you had. A pain that you're only getting at night. Back pain with trouble urinating, weakness, fever, or unexpected weight loss. Okay, these are big red flags. Go see someone, a professional. Okay, in that case, I am not the professional. That is your PCP. Okay, so what's your next steps? What are you going to do next, everybody? All right, so go get an assessment. Okay, so that's someone you can come in to see either of us. We've talked about it, Fusionetics certified professionals. So we can take you through basic movement efficiency screens and easily take a look at, if you were overcompensating on one side, if you have a muscle imbalance or a dysfunction, this can all lead to that lower back issue. So come see us. We'll give you a screen. We'll give you added stretches, self-myofascial release, mobility drills, exercise, strength exercise to do that can get you away from that lower back pain. Try another stretch, whether it's one of the ones you saw here. If you want to meet up with us and we can give you some more stretches, you can use the World Wide Web. Okay, there's a bunch of stretches out there based on exactly what muscle you want to hit. YouTube videos are great for this. Try to break up those long periods of sitting or inactivity, whether it's setting a timer, getting up and moving, and just whether it's different posture exercises, strengthening certain muscles that are going to improve your posture. Okay. So that is our lower back What's What webinar meetup. Thank you for listening and watching. If you have any more questions, feel free to reach out to myself or Janet. If you would like any of those movement efficiency screens, also feel free to reach out, and stay safe.